Thank you very much. Hi, this is Yasuhiro Homma, a corresponding author of the article titled Validation of Preoperative Formula to Estimate Postoperative Pelvic Sagittal Alignment and Mobility before performing total hip arthroplasty for patients with hip osteoarthritis. It is an honor for us to receive a gold award of arthroplasty third academic paper contest. Thank you very much. So the first author of the study is our colleague, Hiroki Tanabe. He is very, very passionate, a reliable person, an excellent and skillful orthopedic surgeon. So today, instead of him, I'm going to present his work very, very briefly. So as a background, recent studies revealed that it is very, very important to know the sagittal alignment and spinopelvic mobility using this standing and sitting position, because those abnormalities are considered as a risk factor for postoperative dislocation. However, it is already known that the alignment, spinal alignment and pelvic mobility will change after the surgery. Tamura reported that after total hip arthroplasty, the pelvis goes posteriorly, and we reported that after THA, the pelvic mobility changes, mostly decreased, and the spinopelvic mobility differs among individuals. So question is it possible to predict postoperative spinopelvic alignment and movement using preoperative factors? And the aim of this study is to develop a predictive formula using preoperative factors to calculate the postoperative sagittal alignment and mobility. So we have 170 THAs for hip osteoarthritis with average 1 year follow-up. The direct anti-approach was used in all cases. So parameters that we investigated were TK, thoracic kyphosis, and LL, lumbar lordosis angle, and SS, which is very important, sacral slope, and PI, pelvic incidence. And we also checked the presence of lumbar spondylolisthesis, scoliosis, and contralateral hip OA. So in those 170 THAs, 85 THAs were analyzed for making the formula, and the rest of 85 THAs were tested for the validation. So this is the result of a formula predicting for three important parameters. The first is postoperative SS sacral slope in standing. The second is postoperative SS in sitting, and postoperative delta SS. So R squared in alignment was relatively high, but R squared in pelvic mobility using SS was not so high. But this result demonstrates that prediction is possible. In the validation analysis, the difference of predicted value and the true postoperative value showed certain match rate, but it was not so exact. So at the discussion, preoperative planning is the key for the success in recent total hip arthroplasty. So sagittal alignment and pelvic mobility are very important. If a prediction is possible, it would be appropriate. However, although the prediction was possible, it was not so accurate. So future study for high accuracy will be necessary. So conclusion, the present study shows the pelvic alignment and mobility of THA can be predicted using preoperative factors for patients with hip osteoarthritis. Higher accurate model is needed. It is it is very important to use a predictive formula to estimate the postoperative condition before performing total arthroplasty. So I explained this article very briefly. So please take a look this article via the internet. And thank you very much for your attention. And I really appreciate to all the members of the Journal of Asia Arthroplasty. Thank you very much.